Hi, my name is Larry Worthen. I'm the Executive Director of the Christian Medical Dental Society. And the presentation I'd like to share with you deals with the implications of the legalization of assisted suicide and euthanasia. First, I'd like to say a word about the Christian Medical Dental Society. We're an organization of 1,500 doctors and dentists from across Canada who gathered together to really support the integration of Christian faith with medicine and dentistry. We have part-time chaplains in 12 medical school campuses across Canada. We publish a magazine. We're active on Facebook and Twitter. And we have a very elaborate website that has all kinds of information on this topic that you can take a look at if you want to learn more about this topic and others related to Christianity and healthcare. On February 6, 2015, the Supreme Court of Canada struck down sections of the Criminal Code dealing with assisted suicide and euthanasia. Specifically, sections 241B and section 14 of the Criminal Code had no force and effect to the extent that they prohibited physician-assisted death for a competent adult person who clearly consents, who has a grievous and irremediable medical condition, including an illness, disease, or disability, which causes enduring suffering that is intolerable to the individual. Now, it's important to read the fine print related to this decision of the Supreme Court. Notice that they refer to a grievous and irremediable medical condition, not a terminal illness. I was watching the national news a month ago and Peter Mansbridge said that this decision had to do with terminal illness. It does not. Notice that all you require is a grievous illness, disease, or disability. That would mean that someone with paraplegia or quadriplegia would qualify. That would mean that this illness could be a chronic illness like rheumatoid arthritis. And that the suffering is not physical pain, but the suffering is has a subjective test, that the suffering is what is intolerable to the individual. So right away we're seeing in this definition things that are different than the public perception of what we're dealing with in the legalization of assisted suicide and euthanasia. I want to share with you a story of a friend of mine, a woman who works with me in the Christian Medical Dental Society. She's our associate staff person in one of our campuses. Her name is Barb Hine. Barb and I were upset to discover that she actually qualifies under the Supreme Court of Canada definition. Barbara has chronic rheumatoid arthritis, which was so bad that when she was in her early 20s, she was hospitalized for 2 years. You can only imagine the disturbance and distress that she experienced at that time, and she confided in me that during her 2 years in hospital, she actually did begin to think that her life would be better off if it was ended. Now, Barb was able to get through that period. She's been able to deal with her disability, and the contribution that she has made to CMDS in the 3 years that I've been executive director is amazing, because she's constantly reminding us of the needs of disabled people and the needs of people in the disability community. But just imagine if this decision had been made when she was in her early 20s, there is a possibility that Barb would not be alive today. And this is the risk that we face in legalizing assisted suicide and euthanasia. Now, one of the things that makes this very difficult is that there's a war of words out there in the public square. But it's important that we use the proper technical terms. Euthanasia means the intentional termination of the life of a person by another person with the intention of relieving the person's suffering. And assisted suicide means assisting a person to commit suicide by providing them with the means to end their life. The difference is, in terms of the mechanism, euthanasia normally means giving someone else a lethal injection. Assisted suicide means giving someone a lethal prescription that allows them at a later time to take that prescription and end their lives. But there's all kinds of euphemisms that are used in the public square. Medical aid in dying is what they use the terminology in Quebec. Physician-assisted death, hastening death. But it's important to remember that we're not talking about people simply deciding that they don't want to take certain treatment. We're not talking about pulling the plug, because we already have the legal right to do that. None of us can be treated if we don't want to be treated. When we decide that the end time has come and we want to pass on, it is impossible for anyone to force us to take any kind of treatment. The problem is when the public hears medical aid in dying or physician-assisted death, they immediately think of, quote-unquote, pulling the plug, when in actual fact, it's actually giving someone a lethal injection or assisting them to commit suicide. Where is it currently legal? Well, currently, there are 5 different countries that have legalized euthanasia: Netherlands, Belgium, Switzerland, Luxembourg, and Colombia. 3 U.S. states, Oregon, Vermont, and Washington, have physician-assisted suicide only. The legislation only allows you to give someone a lethal prescription. That's a very important distinction for us to make. What do doctors feel about this, the doctors who are concerned about it? And by the way, 75% of all palliative care physicians in Canada are opposed to the legalization. 75%. What do they know that we don't? Well, the first thing is it's difficult to detect a cognitive impairment. For instance, when my friend Barb was in the hospital, was her depression sufficient to keep her from being able to provide consent if she had wanted to end her life? And the Canadian Medical Association itself says that it's very, very difficult to determine when someone is depressed whether or not they are actually able to consent to this. There's a risk of coercion and undue influence. You know how vulnerable people are. You know how they also are very vulnerable to guilt. Sometimes you see elderly people say, "I'm such a burden on my family." Well, if you had an unscrupulous family member who would work on that guilt, could that person then be coerced into ending their life? In all of the jurisdictions, there is a non-compliance with protocols. So no matter what things are put in legislation, those protocols are very often not followed. There's the fallibility of prognosis. Doctors will tell you, they can say that you have 6 months to live, and then come to find out later that you end up living for 5 or 10 years after that. And in addition to that, it has been documented in Belgium that there are doctors perform life-ending acts without a specific request. In other words, the person does not request to have their life terminated, but in the survey that was done in Flanders, Belgium, 32% of all cases involved euthanasia without the patient's consent. So many patients experience vulnerability at the end of life, particularly after a traumatic injury or following the diagnosis of a debilitating illness. It could happen to any of us here. God forbid, we could, on the way home tonight, could have an accident that puts us in hospital without the use of our legs, or perhaps even worse. And any of us could fall prey to discouragement and depression, such that even though we could still legally consent, we might not recognize that if we can just get through this difficult period, we may be able to adjust and lead a healthy, happy, and productive life. This is the problem with the legalization of assisted suicide and euthanasia. There is a tremendous risk of wrongful death. And the other problem that I think is important to raise is that we're not talking about pain at end of life. Palliative care physicians will tell us that all pain at end of life can be dealt with proper palliative care. The problem we have right now is that only 30% of Canadians have access to appropriate palliative care. And so the concern is that are we short-circuiting our need to provide proper palliative care by allowing people to end their lives using euthanasia? And for a compassionate country, we have to ask the question, are we making this decision because of scarce healthcare dollars or because of a so-called concern about compassion for patients? Wouldn't it be better for us to ensure that there is appropriate palliative care all across Canada first, and then determine whether there's a need for assisted suicide? The Canadian Medical Association, in their brief to the Carter case, talked about how hard it is for physicians to determine whether or not the patient can legally consent. The CMA submits that the challenges physicians will face in making these assessments have been understated. This is the CMA politely trying to indicate to the judges that decisions are made in hospital and in medical care in a very dynamic, active, and turbulent environment. The judges, I think, seem to project the environment in which they make decisions onto the medical care system. So they assume that the doctors are making these types of decisions with all of the time that judges have, with both sides being articulated as it is in a courtroom, when in actual fact, doctors are under daily pressure to keep beds clear and to move people out of hospital. Doctors I've spoken to are very, very concerned about the capacity to be able to spend the time required with the patient to determine whether or not they are in fact consenting to this. And the palliative care physicians tell us that pain is rarely the reason that patients ask for a hastened death. It more often comes out of a desire to control the circumstances surrounding their death. With current tools and resources, pain and other distressing symptoms can usually be controlled and support provided to ensure comfort and quality of life. I want to just tell you briefly the story of Jeanette Hall in Oregon. Jeanette Hall was a lady who was very supportive of legalized euthanasia in Oregon. She voted for legalization, and she was given a diagnosis of having 6 months to live. She came to her family physician and said, I would like to have assisted suicide. The family physician was philosophically opposed to this, and he tried to stall her. So he stalled her for 2 or 3 visits until finally she forced him to talk about it. And as he began to talk with her about it, he basically was trying to convince her not to do it. She essentially went along with him when he suggested another treatment they could try. And the end result is that she is still with us today, some 14 years later. She says, if my doctor had believed in assisted suicide, I would be dead. I thank him and all my doctors for helping me choose life with dignity. Assisted suicide should not be legal. Don't make Oregon's mistake. Now we move to Belgium, where identical twins who were deaf since birth were slowly becoming blind. They were euthanized on December 14, 2012 in Belgium. They had lived together all their lives, and they were afraid of becoming dependent on others. When you think about it, these twins satisfy all of the categories in the Supreme Court decision. They have a disability, they have a grievous disability, or at least it's grievous in their minds, and they don't want to put up with the suffering of being hearing impaired and then also becoming visually impaired. But what we haven't considered yet, because it isn't law, so we don't have any experience, what we haven't considered yet are the circumstances that would lead someone to the point where they would want to end their lives. And these circumstances can be a traumatic incident like this. They can be sudden onset of an illness. They can be upset and conflict within a family. They can be a lack of funds to live in an environment that you consider to be suitable. All these things can be a trigger. We're shown on television right now stories of people who are at the very end of their lives. They might have 8 days to live. They tell us that they're suffering in agony. And everyone goes, well, who am I to say? But when you actually apply it and you try to put it into legislation, then this is what happens. These are the results that you end up getting. People that you never ever considered should be eligible for this suddenly are eligible because it's not possible to open it to one group and not to the other. Here's another aspect that people don't think about. It's got to do with the relationship with family. Dr. Tom Mortier is a chemistry professor in Belgium. His mother, Lieve de Troyer, lived with chronic depression. She was widowed after the suicide of her husband and later experienced a breakup in a long-term relationship that made her depression worse. On April 19, 2012, Lieve died by euthanasia with the recommendation of one psychiatrist, even though the legislation requires 2 psychiatrists. And I want to tell you how her son found out about it. He got a call from the hospital asking him to come and pick up his mother's things. He said, why? They said, because she was euthanized this morning. This was the first he heard of it. This is what will happen in Canada because of the privilege between a doctor and a patient. Even though the Quebec legislation, for instance, recommends that the family be consulted, there is no legal requirement that the family be consulted. So this could happen. And to make matters worse, in Belgium, they've revised their law now to allow children under the age of 16 to be euthanized as well. Here's another one, and from Oregon. Dr. Charles Bentz had a 76-year-old patient who became depressed after being diagnosed with cancer. Bentz referred his patient to a cancer specialist who soon called Bentz to provide the second opinion for his patient to die by assisted suicide. Bentz said that the patient did not qualify because he was depressed. His patient died by assisted suicide 15 days later. The other so-called safeguard that's in the legislation is they say, well, you need to hear from 2 doctors. But there's no requirement that the 2 doctors be the family physician or the psychiatrist of the patient. See, the problem is that once you open the door to this, there will always be doctors who will take an extreme view of it. They will say, if you ask me to kill you, then I should, because patient autonomy is the #1 concern. So the circumstances are really immaterial. If the patient wants this, they should have it. So once you open the gate to that, then it becomes very difficult. You have to then try to rein in every individual doctor, because there will always be some who will push the envelope. There are some in Holland now, the pro-euthanasia doctors, who are proposing that everyone over the age of 70 should be able to get euthanasia just simply by request. You might have seen the video by Dr. Donald Lowe. He was a doctor who was in the last stages of cancer. He had about 8 days to live, and he did a video basically making a plea for assisted suicide to be legal in Canada. Dr. Lowe, however, ended up dying without pain, according to his wife. He died in his wife's arms. But she said he did not get the death he wanted because he wanted to choose the time and place of his death. She herself was quoted as saying that she felt like she was living with a virtually dead man for the last days of his illness. But what I want to compare that with is the testimony of another friend of mine, Steve Passmore, who was born with cerebral palsy, and he has lived all of his life with that condition. He said, most people who live with disabilities generally live with pain, suffering, and social isolation. Legalizing assisted suicide or euthanasia is an abandonment to him as a person, that society would rather help him die than help him live. The concept of euthanasia creates great fear for me. What he basically was saying was that what Dr. Lowe was experiencing was for him a day-to-day experience. And if society says it's okay to kill someone who's experiencing what Dr. Lowe was experiencing, then why is it not okay for someone to end Steve Passmore's life? The major leaders in the disability community in Canada are very opposed to this legalization because of this danger. Last summer, I was in Holland and I met with this man, Dr. Theo Boer. For 9 years, he was on a euthanasia committee in Holland that approved cases of euthanasia. And what he said was that he and his colleagues were wrong, terribly wrong, about legalizing euthanasia in Holland. In fact, beginning in 2008, the numbers of euthanasia deaths show an increase of 15% annually year after year. And I've gone back and checked these statistics. He's absolutely right, and it's another 15% for 2014. And that the euthanasia of patients with psychiatric illnesses is now sharply on the rise. Some patients are euthanized largely because they are aged, lonely, or bereaved. Some of these patients could have lived for years or decades. And these are the numbers in Holland. And you can see that we're dealing with thousands. They've had a much longer track record with euthanasia than other countries because they started in the 1970s. But you can see that something that is unusual or an aberration in the beginning tends to catch on and then become socially acceptable. Will it ever become socially acceptable to the point where people are wondering why you are hanging on and why you're not using euthanasia? Also, I want to introduce you to Hendrik Reitsma, another man that I met last year in Holland. Henk had the experience of his grandfather being in hospital, and this is about 20 years ago in Holland, and the grandfather was in for an unrelated illness, While he was there, they discovered that he had cancer, but he had about 3 or 4 years to live. Unbeknownst to the family, the physicians had a conversation with Hank's grandmother and grandfather, who were very elderly. And when Hank's aunt came in to visit her father, she went to give her father some water, and the staff said, "Why are you doing that? It's only going to prolong his death." And she said, "His death? What do you mean?" And they discovered that they had this conversation with the grandfather and the grandmother. The grandmother had misunderstood and had approved that he would be basically deprived of food and water to end his life. Now, you might think that's just a one-off case, but in actual fact, there's been a recent study by Lancet, which is a medical journal from England, and you can see that the actual cases of euthanasia grew gradually in the 10 years between 2001 and 2010, but continuous deep sedation, which is a way to sedate people to take away the pain and distress of death, has increased dramatically, more than doubled in those 10 years. And this number here is way higher than Canada. The highest number I can get from palliative care physicians is around 1%. And in addition to that, the number of deaths after intensified alleviation of symptoms, in other words, the patients are given large doses of painkiller, were almost doubled from 20.1% in 2001 to 36.4% in 2010. So what seems to be happening is that with the legalization of euthanasia, people are saying, well, look, rather than using formal euthanasia, what we'll use is increased levels of medication to achieve the same result. And there was a Dr. Lowe who did a comment basically saying that it appeared that doctors in the Netherlands were using this form of ending people's lives rather than going to formal euthanasia. And the scary thing is that in 42% of these cases, the physicians did not discuss the decision with the patient, relatives, or other physician. So they're giving large doses of painkiller, which end up resulting in the deaths of the patients, and in 42% of cases are not even discussing it. Now, a lot of these statistics were raised with the Supreme Court of Canada, but their response was, well, hopefully the experience of Netherlands and Belgium will not be our experience here. Legalizing physician-assisted suicide has implications for healthcare professionals as well. And of course, our organization is very concerned because of conscience protection. We've got 2 provincial colleges. They are the groups that regulate doctors in Canada, in Saskatchewan and Ontario, that are considering policies that would require physicians to refer for, and in some cases to perform procedures and give pharmaceuticals even though they are against their conscience. And our organization is currently challenging the Ontario College in court because of this. Christian doctors, many of them, do not feel that their conscience allows them to refer for something knowing that the patient is going to get a procedure that they think is immoral. And they're particularly concerned about things like contraception, abortion, and euthanasia. And there are many doctors now who are actually considering leaving Canada because they're afraid that if euthanasia becomes legalized, they'll be forced to participate in it against their will. Now, in the Carter case, we did get some supportive wording from the Supreme Court of Canada. They indicated that the physician's decision to participate in assisted dying is a matter of conscience and religious belief. But the court left it up to provincial colleges, parliament, and provincial legislatures to work out the details. What that means is that we're going to have to lobby with every provincial legislature and every provincial college in order to make it so that Christian doctors can continue to practice. My wife is a Christian doctor. I get patients coming up to me all the time. Oh, it's so wonderful to have a Christian doctor. Well, the time has come for you to fight to keep Christian doctors. Because as this is going forward, it's going to be an incredible challenge to ensure that we are able to protect our Christian doctors and their practices. The concerns are about referral, about actually being forced to perform procedures, and the other piece, discrimination for not performing. Once you consider that euthanasia is a medical procedure, and you're hiring someone to be a palliative care physician, don't you think that the government departments of health will eventually be able to say, well, if you're not prepared to provide all the services for end of life, then you can't have this job. And essentially, people will be discriminated against because of their religion. Now, where is the Christian community in all of this? This should be clear to us exactly what our position is on this, because God and Christ have been very, very clear in the Ten Commandments and the teachings of Christ. You shall not kill. And Jesus said, you know the commandments, do not kill. And God talks about the sacredness of human life. For you were created in my inmost being. You knit me together in my mother's womb. I praise you because I am fearfully and wonderfully made. Your works are wonderful. So God sees the beauty of every human life. And Jesus, during his time on earth, went about teaching and preaching and healing every disease and every infirmity. He did not go about killing people. Unfortunately, our society has been heavily influenced by an ideology that came about in the modern era that is what I call classical liberalism, or a strong individualistic tendency. And so in our society today, the one thing that seems to drive our public debate is, I am in control of my own life. Who are you to tell me what to do? And so many of us are frightened. We're scared to say anything, to argue with this, because we see Dr. Lowe and we say, who am I to tell Dr. Lowe that he can't die 8 days early if he wants to, right? And so we're all scared to challenge that. But what gives us the right to challenge it is that Dr. Lowe's decision to die 8 days early affects my decision to die without euthanasia. What that means is that all of you will be denied spending the end of your life in a place where you are free from euthanasia, where there is no risk. So the right you have to speak up is that it affects each of you. His decision to die 8 days early affects your decision to die without the risk of euthanasia and assisted suicide. Without the risk that you're going to be at a low point at some point during your illness, and some nurse or doctor is going to come along and tell you, look, this is the easy way out. And you might decide to take it. That's the risk we all face. The reality is that this idea of the individualistic society is completely false. It's not anthropologically correct. There's never been a society in the world that has ever thrived by everyone looking after themselves. This is what we Christians bring to the picture. But we're largely silent because we don't want to go against the grain. But the grain, the challenge, is coming to you, and it's coming to me. And it will come to us at end of life. It will come to us in the form of pressure, explicit or implicit, to end our lives prematurely. And on pressure on our Christian doctors, which is explicit, to give up their ethics and morals and to bow down to this individualistic ethic, that whatever the patient decides they want, the doctor must provide it, even though it will crush the doctor. It will force the doctor to do something against their conscience. Choice is an illusion. It's a one-way street. It's used by people who want these things to be part of our social fabric, but when it comes time to doctors being able to opt out, they're not allowed. So we need to get past the rhetoric and recognize what's really happening. Last year, my wife and I went to Auschwitz. And I just want to read this. The one who does not remember history is bound to live through it again. George Santayana. We were astounded by Auschwitz. But we were even more astounded when we went to the National Museum in Berlin and we saw the history of Germany, the 1920s and the 1930s, as the Nazis rose to power with their racism and their supremacy. And we asked ourselves, why was everybody silent? Why were they quiet? Why didn't they speak out? The reason is they were bullied. And we're being bullied now. We need to stand up for the elderly and the infirm, the disabled, because our society is putting a price tag on human life. Forever let this place be a cry of despair and a warning to humanity, where the Nazis murdered about 1.5 million men, women, and children, mainly Jews, from various countries of Europe. It's time for us to do something about this. So I hope and pray that you will consider getting involved and taking action.